So a little bit of a quiz. I'll just put the questions out there, and maybe you can put in the chat what you think the answers are. So number one, how about we deal with number one first? So are sports medicine doctors orthopedic surgeons? You want to put it in the chat? You can put a yes or a no.
We have one no. I'm just going to
Okay.
wait for a couple more answers.
Okay, Eugene left.
Eugene is not enjoying the quiz format. Declan says no. Sophie says no. Sandri says no.
Right.
That's all our students today.
So do sports medicine doctors only treat athletes? No. No. Fantastic. Do sports medicine doctors do massage?
Yes to the question mark.
Okay, I'll be honest with you. I have been known to do massage sometimes, especially when you're away with a team. So, once I was with the England under-19 women's team, and at one point I think we had 38 players. So it was overwhelming for the physiotherapist. So I had to chip in and do some soft tissue massage as well. So I mean, I have to say my skills is probably not as good as the physios. But I gave it a good go, and I think I did all right. I don't think anyone was kicking the ball the wrong way after I finished. So yeah. And the last one is you can only become a sports medicine consultant after specific training. Yeah, correct.
Is that right? Is it no, yes, question mark, and yes?
Yeah, kind of, yeah.
Okay. All right. I think everybody got it right then. Yeah.
Yeah. Brilliant. So if you all have any interest in sports medicine, I mean, I post a lot of things on my YouTube channel, but I also have that talk about the quadriceps injuries and various other things there. A lot of it, the focus is on ultrasound and ultrasound treatments. But if you have an interest, please feel free to have a look at the YouTube channel. It's been something that I've been quietly tinkering on with for the last few years. And if you have an interest in sports medicine injuries, this is a free website that some colleagues and I put together during COVID time. So it just covers a lot of sports injuries, musculoskeletal issues, performance issues, and so on, and different treatments. So again, no subscription required, but you can just have a look and browse through. And then lastly, for if you have an interest in getting some experience in sports medicine, or just want to do some clinical shadowing, maybe a placement or something like that, please feel free to WhatsApp us, and maybe through Prep Zone or through my nurse, we can arrange a day or a week that you can come in and shadow us. So do reach out if you have an interest.
I think maybe as a start, I would say if the people on this chat are all interested in going down for a visit, we could arrange that together. So we're also using Dr. Dinesh's time better. So let us know, let your consultant know. You can email me as well, and we can set up a time if a bunch of us are interested. Yeah. And in that case, I might start asking some of the questions I've been receiving. There's quite a few of them.
Okay. So how about I stop sharing then? Yeah.
Okay, sure. Yeah. I've done my best to make them in order and combine questions that are similar, but we might still go back and forth.
Okay.
So just going to start with, functionally, what is an example of a skill that may be different between an SEM consultant and a sport physician? I think that's a distinction you were drawing in the earlier bits that were new to a lot of people here.
Sure. So I think one of the key things is that as a SEM consultant, you tend to go into things in a lot more depth than a sports physician or a sports doctor might be. So as I mentioned before, somebody who's done a master's or a graduate diploma in sports medicine might say that they are a sports doctor. They have a sports medicine interest. Now, the difference is that when you go through the specific training, you have to go through a more rigorous assessment process as well. And so as a consequence, your understanding of different things tends to be that much deeper. There's a strong emphasis in sports medicine on musculoskeletal ultrasound as well. So we do a lot of different procedures using ultrasound. And it's somewhat different to what orthopedics and radiology do, in that radiology, the focus tends to be more on the diagnostic aspect. The orthopedics tends to not use ultrasound so much, but they might do some similar procedures like injections, but they tend to do it without visualization. And in sports medicine, I think we try and kind of bridge that. So yeah, that tends to be a big difference.
Okay. In a sports team, what would be the difference of responsibilities between the lead physiotherapist and the lead club doctors?
Okay. So actually, I had a nice slide on that, which I didn't include. But typically, what happens is the physician is involved in the initial assessment and diagnosis of a problem. So let's say somebody is not able to run so well, or they get back pain. So you might be involved in arranging investigations. You may be involved in the initial kind of diagnostic part of it. You may also be involved in certain interventions. So, like I said, I do a variety of different interventions for injuries, and you might be the person who does implements those. Then, obviously, you will be working with the physiotherapist in that assessment process, in that management process, and as the patient or the athlete transitions from that initial treatment and assessment, they'll progress onto rehabilitation. You'll be involved in making sure that they get to the goal of getting back to sport as well. So it's almost like a transition from the physician to the physiotherapist as the patient kind of improves.
Okay, thank you. Were you in your final stages of training when you worked at the London Olympics and Paralympics? And what was that year like to be practicing while you were studying?
So as a sports medicine trainee, I think the expectation was that we were all going to be at the Olympic Games, particularly the London trainees, because it was a London Olympic Games. But it was great. I mean, we took time out from our clinical training to really go and dive into the Olympics. When I was at the Olympic Games, I was involved with the hockey. When I was at the Paralympics, I was involved with the athletics. So I have to say, it was a real awakening to be involved with the para athletics, because it's incredible what people can achieve with without limbs, and with being able to see, and it's remarkable. So I think what it teaches you is that some days we get up and we feel like we've got out of the wrong side of bed. These people have to deal with that, as well as the disabilities that they face, and yet they do remarkable things as well. So I think it was a phenomenal time. It was very tiring, but I think it was an amazing time to be involved in it. So yeah.
Okay. And how did your interest in medicine evolve from obs and gynae and family planning to sports medicine towards the end?
So I think, I mean, I did those things because I thought they were important as a primary care doctor to have a better understanding. And I think it also was to complement some of the rotations that I was doing as a primary care trainee. So I rotated through pediatrics, and I did a little bit of gynecology, but not quite as much as I wanted. So I went ahead and sort of did a little bit more learning there. And then afterwards, I realized that actually, maybe primary care wasn't for me. And then the sports medicine thing came along. I'd been sort of interested in it as an undergraduate, and then when I saw this opportunity, I was like, oh, maybe I'll go and learn some more about it. Went to a few British Association of Sports Medicine events and meetings and things. I was like, oh, this is really quite interesting because of the range of things that you do. And then I kind of applied and got lucky, I guess. So and then it's just been that since. I mean, I still do a little bit of primary care stuff because I think it is interesting to go back to it on and off. But vast majority of my practice is now shifted to the sports medicine side, and more not necessarily just consults and screenings and things like that, but more the interventional stuff as well.
And you mentioned you did a master's research project as well. What was that about?
So I did two masters. I did one in sports medicine and one in clinical education. So the sports medicine one was looking at ligament stability in the knee. which didn't get published, but the systematic review that I did for it got published. And then the education one was looking at physical activity knowledge amongst healthcare professionals in Singapore. Is it in Singapore or no? Amongst medical undergraduates, and we did a comparison between UK and Singapore, and that got published in Singapore Medical Journal. So yeah.
Okay. I have a couple of questions around specific sports, so I'm going to ask the general ones first.
Sure.
When SEM specialists start to specialize, does it help or hinder to focus on any one sport? And do you experience major differences in the medicine needs of one sport compared to another?
I think as you are in a training program, it's good to get a broad breadth of different sports and experience different things. But as I mentioned, some of my colleagues have really kind of focused on specific sports. So, you have football doctors, or you have doctors who are very much involved with basketball and so on. And maybe for a time that's their area of specialization, but at any given time, I guess they could change and pivot. There are the good thing about sports medicine is there are lessons to be learned from all sports that can be translated to other areas. So the way I look at sports medicine is you're looking at in the elite athlete, you're looking at F1 cars. Okay, so you're dealing with McLaren, or you're dealing with Ferraris and everything like that, and you learn a lot of lessons from dealing with those and getting athletes back to sports very effectively and treating them and so on. But then you deal with the general population as well, and you deal with different aspects of the general population. So you deal with amateur athletes who are really, really good, but maybe not in the elite phase, but they want to kind of perform at a very high level. You deal with junior athletes who are kind of growing through the ranks, and you deal with uncles and aunties as well, who just want to be able to do the sport that they enjoy, or just walk better and so on. And actually, my oldest patient is in their 90s, who's he's a former vascular surgeon who's retired, and my youngest patient has been 8 or 9. So it's a very wide range of patients that I have, and I think you take lessons from the various sports and from that elite environment and bring it down to everybody else.
Would you say there's differences in what's expected out of sports medicine based on which country you're practicing in?
I don't think it's just. I think everyone wants to get better. In whatever line of medicine you're in, everyone wants to get better as quickly as possible. But I guess there may be differences in terms of funding. So and also, even in one country, the level of funding may differ according to the sport. So if you take, for example, US athletics or something like that, of course, that's a very high profile and well-funded sport. Whereas if you take, I don't know, floorball or something like that, it's going to be slightly lower on the rung. Or if you take basketball, it's going to be higher up. So depending on the sport, I think there's probably more variability in terms of the expectations and everything, as opposed to necessarily country by country.
Right. I think maybe I'm adding on a little colloquial knowledge here at this point, but I'm wondering if there's also differences in what a country tends towards in terms of treatment. So for instance, ligament injuries being very common in my sport. I play volleyball. And they tend to be pushing surgery in Singapore the way that it wasn't done to me in the UK. Do you see that as a common thing? Do you notice those trends?
I think one of the good things that sports medicine has done is it's disrupted the dogma that everything needs the knife. So I've had a number of patients with meniscus injuries who've got better after doing a PRP injection, and they haven't necessarily had to do surgery for that. You understand? Particularly stable meniscus injuries, and I've had patients go back to skiing, running, football, even after that. And typically, if they went to see a different doctor, they might have said, "Oh yeah, you need to go for surgery today." Whereas I'm like, "Well, we could try this injection first, try some rehab first. We could try rehab first before you try the injection. We could try all
Yeah.
these other things before we go down that road." And I think what it's meant is that it's not that sports medicine's a disruptor. It's sports medicine fills that gap between
Mm.
rehab and more surgical treatment. It's really kind of made things flourish, and the good um, surgical doctors are more aware of that now, and they're embracing that. Whereas I think the ones who are still very traditional just say, "Well, okay, you just need this. This is it's either option B or that, or there's nothing in between." So I do think it has made people rethink what options are available.
Okay.
Mm.
One more question on injuries. There's a student here who's writing their sports science extended essay on football injuries.
Right.
And they're asking if you've noticed or if you see a pattern between why there are so many ACL injuries in female footballers and
Oh,
what the main factors might be for women having or for female athletes having more ACL injuries than men.
I mean, I think that's the holy grail of ACL injuries, and that it's been well recognized for a long time that female athletes typically do have more ACL injuries than men. I think there's a number of different factors that people have postulated, and some that people have said, yes, actually they are pretty certain that they're risk factors. One of them is obviously, the anatomical thing. So slightly wider pelvis, there's a change in the Q angles and so the movements. Um, People have postulated things like menstrual cycle as well in terms of ligament laxity and so on. Um, I think other areas have been in terms of what's available extrinsically. So, looking at strength and conditioning or prehab or injury prevention things. So, in the EPL, obviously a lot of money goes into preventing injuries in these footballers and everything. And not always has that been available to the female footballers. But now I think because women's football is getting much more popular and is played at a very high level now. I think it's increasingly these budgets are starting to become more available for them as well. So there's a lot more emphasis on prehab and injury prevention and so on. So there's all sorts of different theories, but actually some of these things also apply to male footballers. So things like trunk
Mm.
control or body movements or footwear that people are using. So we know that
Mm.
blades are more prevalent to having to getting stuck in the ground than studs. So if you pivot on blades, there's more forces in the knee and so on. And so all of these things can be contributing factors. But I
Right.
certainly think that there's ongoing debate about that.
Okay. Okay, we're zooming out a little bit and asking about your industry now. Maybe we'll take a few, like 3 or 4 more questions. So the question is, what is the latest development in sports and exercise medicine that you and your industry are most concerned about?
Oh wow. I guess the big thing that everyone's worried about is AI now, right? And
Yeah.
how it's going to be a big disruptor.
How
I
does it affect you, though?
I would say that from I mean I've been sort of mildly introduced to it a bit in that in the consultation people are using AI to write consult notes and letters and things like that, which is great. Everyone hates writing letters and things like that, but it could be a very useful tool. I think it does help in the cognitive sort of processing. Maybe reminding you of other possibilities in terms of what the diagnosis could be. Um, I think from a practical standpoint, it's still a little bit far off in terms of the treatments and things like that, because in sports and musculoskeletal medicine, it's a very physical modality. You understand? It's not
Mm.
like maybe radiology or dermatology, where you can take a picture of a certain rash or have a look at an X-ray and say, well, these are the findings and so on. So
Right.
I think there's an element, there's a little bit of a gap there that needs to be filled in. But with the evolution of things like robotics and AI, I think things will catch up. But it's just maybe a little bit. There's a little bit the curve's a little bit behind on that one. So yeah.
Mm. Okay. Then there's a general question around what is your work environment like? Is it very consistent or quite ad hoc, considering you work at events and other places as well? And are there any specific challenges that come up working with athletes? So that I think they mean emotional and psychological challenges.
Yeah. I mean, for me, there's a fair bit of consistency. I work in a clinic. I do a little bit of work at NUH, and the other time I'm in the sort of day surgery setting, and so there's somewhat consistency there, day to day. But when you do go to the sports environment, it can vary. Um, the main thing is that you may not always be working with the same people. So, you may be there, but there may be different paramedics there with different experiences. There may be different equipment available. People may be running on different protocols and so on. And so one of the issues is standardization of care, which can be quite difficult. And what you do learn is that you have to do like practice run throughs, and you have to make sure that everyone is sort of singing from the same hymn sheet, that everyone has different roles allocated when some emergency happens, and so on. So there are various things that need to be done for each event. And unless you have consistency in that team, then you have to just take it as everything is new.
Okay. I will ask one final question. So students, if you were mulling over more, do not send them to me anymore. Just email them and we might send them to Dr. Dinesh later. The question is, what is the best and worst part of the job that you've experienced in your career so far?
Oh, sorry. Actually, I think I forgot to answer one part from the last one. What's the challenge of working with athletes?
Yeah.
And the expectations, I think, is
Yes. It was emotional and psychological challenges possibly of working with athletes.
Yeah, it can be very, very challenging. And I think I think the same applies for everyone. Everyone wants to get better in the shortest time frame, but sometimes, unfortunately, our bodies don't allow us to. And even sometimes after treatments, I say to all patients, whoever I treat, that the worst case scenario is that it doesn't help as much as we hope. Now, whether everyone hears that or not, I don't know, but I do say that because I think it's very important to be aware that not all treatments can help you recover. You may need something else. Sorry, what was the last question again?
The best and worst part of the career so far.
I guess the best part is the diversity. I've been able to work with all sorts of different people in all sorts of different situations. I've developed, I guess, a skill set that is unique to myself in the sense that other people may have an interest, but unless you go away and learn about it and practice it, what I learn may be slightly different to what other people do. And I guess I've kind of crossed different boundaries in the sense that I learned a lot from radiology or pain doctors or physios or podiatrists, and I've taken learning from different places. I guess the worst parts of it is sometimes people aren't aware necessarily what sports medicine consultants do. Like I said at the very beginning, some patients say, "Oh, are you a physio? Are you an orthopedic surgeon? Are you a chiropractor? Are you an osteopath?" And also in the sense that one of the drawbacks is, like I said, you do spend a lot of time either learning, or you do spend a lot of time away with teams and things like that. And less so now for me. But when I was in the UK, I did travel a lot with rugby teams, football teams, and so on. And so there was a lot of time away from home.
Okay. Thanks so much. It's been an hour and 15 minutes of you just sharing this world with us. And it's been really, I've really enjoyed it. Judging from the questions, the students have really enjoyed it too. And it's really valuable to have you with us today. Thank you for your time.
No, welcome.